Well, good afternoon in the UK. It's my pleasure to welcome our special guest today, and we're going to bring them onto the stage now so that you can see what they look like. And I'm going to ask each of them in turn, to introduce themselves and just to say a little bit about their background and about the company before we get into the business of cognitive assessment and everything that is related to that. So I'll begin with you, Bebiana. Would you like to introduce yourself?
So first of all, thank you very much for the invitation. My name is Bebiana Moura. I'm responsible for partnerships at Virtuleap. I'm actually a biochemist by training. I did research for almost 10 years in labs a little bit across the world. So I did my PhD at Yale University. I did a short postdoc at Heidelberg University, all very in subjects related to basic research. Then started working for a couple of years on grant management when I returned to Portugal, healthcare related projects, and then joined a Portuguese company as their head of discovery, so helping others in the discovery and development of new drugs. And then 2.5 years ago, I joined the team at Virtuleap, where I'm basically responsible for partnerships for the development of our solutions. Nico, do you want to go?
Sure. So you are, sorry, so can I just ask you very quickly? Yeah. So you're in Portugal at the moment, are you?
At the moment, we're in Portugal, yes. So our base is in Lisbon.
Well, I hope the weather is better in Lisbon than it is here.
Well, today, grayish.
So Nicolas, what about you? What's your background?
Yeah, first of all, thank you for the invitation. It's a pleasure to be here. My name is Nicolas Morgenstern. I am a medical doctor by training. After my medical school, I did my PhD in neuroscience. And after that, I did a lot of working as a postdoctoral researcher in brain connectivity, mapping brain circuits using electrophysiology and optogenetics. And at the beginning of this year, I switched gears to my position as lead neuroscientist in Virtuleap, where I'm responsible for the research and development part of the company.
Okay, so you're a neuroscientist, which obviously is very relevant to the topic in hand. So I'm going to ask the two of you, which of the two of you would like to begin speaking and telling us about, well, first of all, Virtuleap?
Yeah, I'll go ahead.
So you'll go ahead.
Yeah.
Okay. So well, I'm going to remove Nicolas and myself.
So basically at Virtuleap, we're working at the intersection between virtual reality and neuroscience to deliver new immersive solutions that can potentially be used in the diagnostics, in the monitorization, and also in the treatment of cognitive disorders. So our initial product is called Enhance VR. It has been around for quite a few years, and it's an app for cognitive training that consists of gamified exercises that are all based on neuropsychological validated tools, and they basically provide cognitive workout across different domains. So we have games for memory, we have games for attention, we have games for problem solving, and this wide range of cognitive abilities that are tackled by our games actually enables its utilization in different use cases. And our goal with this library of games, fun and engaging games, is to actually have it validated and certified as a medical device in the medium term. We are now working on a second product that is called Cogniclear VR, and this one actually tackles one huge need in the dementia field, which is the early diagnosis of cognitive impairment. That's one of the biggest needs right now for the huge impact that dementia has on society nowadays. And so based on validated tests like the MoCA test and MMSE, we basically transform them into exercises in virtual reality that basically consists, right now the test consists of 14 exercises across 8 different abilities. It's a self-paced test, and the idea is that the examiner
You have gone. You are frozen, Bebiana.
Going to be able to actually provide a more sensitive detection of the first symptoms of cognitive impairment. And I think in a nutshell, this is the two products that we have.
Oh, okay, thank you. That's very, very helpful. Just to put a bit of context behind all of this, I mean, my background is not clinical. My background is in technology. I was a founding director of the Serious Games Institute. So I'm very familiar with the use of serious games for a wide range of different things, from behavior change to things like detection of various kinds of impairment in a game style environment. And I work with an Italian company called Imaginary. I don't know whether you know of them, based in Milan. And they also have very similar kinds of products. So if I understand you correctly, your first product that you talk about was basically a mobile app. Is that correct?
No. It's all virtual reality. So all the products in the company basically are based on virtual reality. We believe in the powers of virtual reality. So we're basically hijacking the different systems of your body and making it believe they are in a real environment, interacting in a naturalistic way. People seem to be more motivated, more engaged in virtual reality. And cognitive training has been around for quite a few years, but there is very mixed research in terms of the effectiveness of.
Yes, your audio's gone again, but I'm sure you'll come back again.
Is actually not ideal, because you're basically taking the motor components from the training, which is really important. And we do think that by using virtual reality, we're going to be able to actually provide a more effective training. So definitely games, but in virtual reality.
Okay, so it's basically both a diagnostic and an intervention tool.
So it's two different products. So Ines much more focused on therapeutics. Obviously, when we actually gather all the scientific evidence that is required to make this kind of statement, but is more on the training side of things, Ines. And then to complement the offer, we are now launching in October our new product that is Cogniclear, and that one is definitely for assessment.
Okay, thank you. Well, I'm going to bring Nicolas in now, so I will take you off the stage temporarily and bring Nicolas in. Hi, Nicolas.
Hey.
So tell me a little bit more about Cogniclear and the science, the neuroscience behind it.
Well, Cogniclear, as Bebiana was mentioning, is our product that we designed thinking of tackling this very, very urgent need from the patients, for the world, in fact, of detecting mild cognitive impairment or dementia at a very, very early stage, even earlier than we are able to detect now. So now what we have, the tools, the doctors have to detect very early symptoms or the earliest symptoms of dementia are pen and paper based tests that are for example, the MoCA test or the MMC test that are basically in pen and paper, and the kind of information you can extract from them, it's in a way limited. What we wanted to tackle with this product, Cogniclear, that it's our assessment product, it's a way more detailed and way more granular way of assessing cognitive status using the same kind of test or the same mechanics of the tests and assessing the same categories that are tested in these classic tests that are used in the clinical setting, but using VR, because in VR we not only have extreme control of the environment, but also the stimuli that the people is subject to. And on the other side of the coin, we can also extract, record a lot of data of all the actions that the users are performing while completing these exercises. So from this data, that it's very rich data, we can then extract a lot of variables with a precision that it's impossible to do in pen and paper. And this is the foundation for us to develop this product. And we hope that when we have enough patients testing this product, we can extract variables coming out of this exercise performing that we can use to detect at an earlier stage that the pen and paper tests some alterations that can tell us this person is in risk of developing dementia.
Well, in previous products or concepts that I've been involved in this sort of field, one of the challenges seems to be that it's not all very, but because everyone is different and everybody has different levels of cognitive function and executive reasoning, etc., it's very difficult to actually make a diagnosis of dementia. And in the interventions that I've seen and the diagnostic tools that I've seen previously, it has been about being able to detect dementia by a deterioration in performance. So I recall some years ago a product, and I cannot remember its name, unfortunately. That's probably a bad sign from my point of view. But it was, have you heard of AARP, the American Association of Retired Persons?
Yeah.
Yeah. Well, they have a virtual platform called Alcove VR. I don't know whether you've heard of it, but basically, this is something that was created for a wide range of different medical and social benefits. So it uses the metaverse to provide a user with their own virtual apartment. So a modern apartment that's got a big television screen where you can watch things with your family, physically or virtually. Avatars can join you. They can watch movies. They can watch educational programs on health and well-being. And as you go around the room, you can personalize it, put your own photographs on the wall. And if you go outside onto the balcony, you can change the environment to be a beautiful ski scene or a seaside scene. And then there is a section there, which is like a health and well-being table, and they're in the form of icons like a book or various objects on a table. You can access different VR environments, and the one that I saw quite some time ago was actually using the concept of deterioration in someone over a period of time. And the way that they did it is they had various games which would detect your speed of reaction and the accuracy of your thinking. One was a boxing game where you had to, when a light came on, you had to box that light. And another one was set in an arrival hall at an airport where all your goods came off the conveyor belt, and you were given 3, 4, or 5 objects to remember. And so as the objects came on the conveyor belt, you had to select the right objects, and so based on keeping your short-term memory. But part of the point behind that was that the metrics were not absolute determinant of dementia, but over a period of time, if people's reaction times, if their accuracy, if they started to decline, it was a symptom that things were getting worse. But from what I understand you're saying, Cogniclear is actually a diagnostic tool which is accurate literally from the first tests that people take. Is that correct?
Well, that's the objective. We are working on that. We are still finishing the product, and the next step will be collect data from a huge or a big number of individuals to get a big enough sample, so we can start calibrating which are the metrics that are, or which are the ranges where the metrics are set, so we can start in a way evaluating where that metric is compared to the population you belong to, saying age match, education match, gender match. But this is work in progress. Yeah, but the idea is that with Cogniclear, this will, once the data is there and we have a good sample where we can calibrate with, it would be something that will give you a scoring that will give you are in this risk, or this number of risk of developing dementia or having dementia. But also, as you were saying, this is of course important also to have some kind of longitudinal follow on the individuals. And although Cogniclear is not developed to do very often, the idea is that you can have your checkups like every 6 months or every 1 year and repeat this test, and you can see how you, if you want, progress, or in the case as you were mentioning, how you deteriorate over time. And this is also something that with time we will collect the data to evaluate. But it's also what you were mentioning. It's very important that the progression of the same individual can give us a lot of information on how the cognitive status is either stable or deteriorating.
So it sounds like a very complex process in collecting the data from a large sample of people to be to create some sort of benchmark which you can evaluate against. And I'll give you an example with a solution that I'm testing out, or I'm using at the moment, which is to do with your biological age. And so at the gym that I go to, it's called Longevity. And the aim is to do a diagnostic test which compares you with the parameters of 10,000 people of different ages. And so it gives you a biological age assessment in 4 different categories. So it compares your strength, physical strength, against this database, compares your metabolic rate and against this database, cardiovascular health, and also your flexibility. So they're using that metrics as a way of kind of gamifying. This is the objective, is that you go to the gym to age younger. So you target improving your strength or your cardiovascular health or metabolic health, and you have a personalized program to help you achieve that. So do you see something like that in the cognitive field as being appropriate?
Well, that's more related to what Enhance is for. Enhance is, in a way, a training tool. It's a training tool. And going back to your previous question, and linking here, Enhance has these sessions. When you start playing Enhance, what you first have it's what we call the benchmark session, that basically calibrates what's your starting point, and where are you going from there. It's going to be followed by the following sessions, so we can again have some kind of progression at the same time that the people is training with this tool, to see how they either improve, maintain, or decay in their performance. And since this tackles several different cognitive categories, the idea is that overall, with your performance over time in different categories, you can have a profile of how you're behaving and how you compare, again, to yourself when you started, but also to people in your same age group and education and gender. So in a way, yeah, it's comparable to what you were saying. We are tackling, we are assessing or testing different categories to generate a global idea of how your cognitive status is.
Okay, I'm going to bring Bebiana back in again now and ask her if she's got
the point.
Yes, yeah, absolutely. Well, this is why I brought you in. Please.
Thank you. So basically, we have the cognitive assessment report, which was what Nicolas was mentioning. So by playing the 15 games, you can export a report that basically compares your scores specifically with users within our database that has 68,000 registered users. And we compare it with individuals of the same age and gender to pinpoint the areas that they need to strengthen. So basically kind of defining already the possible intervention, cognitive training intervention with the games of enhanced VR. So kind of the effect that you were saying, you do the evaluation and then you go and do personalized training that is focused in improving the cognitive abilities that you are weaker in comparison with individuals of the same age and gender. So that's something we offer. Cogniclear is more assessment for individuals, not healthy individuals. We're talking about older adults that start having some kind of cognitive complaints and that there is a suspicion that they might have some kind of neurodegenerative disorder.
Can I then move on to actually how you get these kind of products to market? Because obviously getting classified as a medical device is important, and it's only fairly recently that software has been started to be accepted as a medical device. So where are you at with medical device certification?
Yeah, so for Cogniclear, it's still at prototype stage, so we're still a little bit far. But for enhanced VR, we published recently 2 papers showing the first evidence that in fact enhanced VR games can improve specific cognitive abilities. To be exact, one of those studies we implemented with a university here in Portugal, and basically the idea was to try to see if by providing training using our games, a subset of our games, we could improve specific cognitive abilities in individuals, young adults with ADHD disorder. And what we did see in that paper is that we could improve their processing speed. In this specific case, the researchers were not interested in attention, which is kind of the domain that is very well known to be affected, but they were more interested on executive function. So we saw an improvement in the processing speed. Last year, 2 weeks ago, we published another paper from a study that we implemented last year, also in Portugal, in which we actually tested other subset of our games, but a population of young adults with intellectual developmental disabilities. And again, we were able to see an improvement in terms of their inhibitory control and also their working memory. So we're starting to gather some evidence of effectiveness, but we're actually also testing it in other use cases. For example, we have another very interesting use case that is actually a project with a university in Barcelona. And the researcher wants to see if by providing training focusing on executive function, it can help teenagers and children better regulate the emotional side of things. So we already have like some preliminary data that shows that there seems to be an effect in terms of internalizing symptoms. They seem to improve in terms of those symptoms, so less anxiety. We are running another study with older adults. So this is a collaboration with Hospital Valdebron in Spain. It's a pilot study still with funding from La Caixa Foundation. And the goal is to try to see if the utilization of our games can actually help slow down or halt cognitive decline in a population that has type 2 diabetes and mild cognitive impairment. So people with type 2 diabetes are more prone to cognitive impairments and to faster progress into the dementia stage. So it's really important to get new solutions that can slow down or halt this progression. So in this specific case, we're going to be looking at obviously cognitive function, activities of daily life, depression symptoms, a couple of different metrics, but also are going to be looking at brain imaging. So we're starting to get some data from initial pilots, but we need to implement pivotal studies. As you're probably very well aware, when we're developing something that we wanted to be a medical device, there's a long pathway. So some of the hurdles are.
Yeah, sure. You don't need to tell me that. No, unfortunately, I haven't had to go through that that nightmare.
Yeah.
But in the UK, we have a kind of certification called DTAC. I don't know whether you've heard of that, DTAC, and there's an organisation called ORCA in the UK, and basically, and they also work internationally. But basically, what they do is that they evaluate clinical applications, particularly ones aimed at the consumer market. So mobile applications and so on. Basically, they assess them against a range of criteria, and basically they're accrediting them for not being dangerous and also having a positive effect. But the good point about that is, from a marketing point of view, is if you get DTAC accreditation, and that's different from a medical device. If you get DTAC accreditation, then ORCA work in partnership with other organizations to provide those organizations with a library of certified applications.
Whoa,
so there's and I'll cite you a case in point, which I think is quite relevant. There is an organisation in the UK called Home Instead, and they provide personalised home care for older people. So it's not a one size fits all. It's intended to be a very personal situation where the carer comes in, maybe not necessarily every day, but 2 or 3 times a week. They get to know the patient well, and so Home Instead have a website. On that website is a library of applications that may be suitable for older people, which might be exercise applications, it might be cognitive tests, might be a whole range of things. But that really is a leverage to any kind of marketing activities that you might want to do. So going on to the marketing, and maybe at this point, I think you sent me a trailer video. Can I try and play that now?
Yes.
Would that be okay? Yeah, let me try and play it now. So that brings me on to my next question is, when is it likely to be launched, and what kind of partnerships might you be looking for? So if people either watching this or watching a recording later on, which is more likely, I suspect, then they know what you've got in mind for potential partnerships, who you're looking for, how you would like to get it to market. So what are your plans in that area?
Yeah, so I can start there. So in principle, middle of October, we're going to have the products ready for more testing, because in fact, this is something we did not mention, but this has been a very long development process, actually almost 2 years of development. And why? Basically, because we've been actually testing it throughout the development. So we've done almost 5 cycles of iterations with testing with end users, actually in the context of a program here in Portugal, a program by Roche and Beta E. So the name of the program is Building Tomorrow Together, Innovation in Dementia, and it has given us the possibility to partner with a hospital here in Portugal, Hospital Lusíadas, and basically test it as we go, as we develop. And I have to say that because of that, I think it's a much better product, and it adjusts much better to the needs of the target users. With this said, we're looking for clinical partners, obviously, that can help us get access to the end users to start really testing it. And in fact, we're already within an European project that is about to start. The kickoff is next week. VR Health Champion is the name of the project. And the idea is to explore a little bit the clinical development of Cogniclear, but also start looking at regulatory strategy to actually get it validated, but also reimbursement strategy. So we were talking about the hurdles to get to the market as a medical device. Regulatory complexity is one of them. The other one is the fragmented market that we have in Europe, and also having access to clinical stakeholders and having the money to be able to implement the pivotal clinical trials. So all these areas are areas of need.
Well, yes, I understand that, and I will promote the recording after today, and hopefully you might get some takers if I share this with the right kind of people. I'm on the advisory board of a small company in the UK in Northampton called VR Therapies.
I'm familiar with them.
You know them, yes.
Yeah.
You know Rebecca Gill is their CEO. I'm not sure what you meant by that remark. So, but she is very passionate about what she does. So, and it does require passionate people, good people, to be able to make a difference to the lives of older people. And having had some sort of experience of dementia in my family, my mum eventually passed away. She had dementia. Manifested itself more when she got things like a urinary infection. It seemed to affect her more. But my partner's father, he spent the last year of his life with us. He died when he was 96 after living with us for a year. And he had absolutely no signs of dementia whatsoever. He got many other comorbidity problems, but dementia was not one of them. So I think it's very important to be able to detect these things early and to make the right kind of interventions. And I know, as I mentioned, the gym that I'm involved in, the founder of that gym has been responsible for setting up a number of national and international gym chains, but he wanted to be able to provide something that was more suited to older people than the typical sort of 25 to 35 age group who go to the gyms. And that's why he came up with the concept of this aging younger. But also, I think importantly, and this is where down the line it might be a potential opportunity, he sees the importance of community-based ecosystems. Where you have a network of partners who look after physical, mental health, nutrition, exercise, and the whole range of other activities. So I'm not sure whether you know the British Society of Lifestyle Medicine, but they are certainly worth looking at. I've just come from their annual conference, and there is a European Lifestyle Medicine conference in Alicante. And that's in just a couple of weeks' time. So if you this is the British Society of Lifestyle Medicine is the one conference that is in my wish list every year, even though I have to pay. I don't like paying for conferences, especially if I didn't speak at this one, but especially if I'm asked to speak. I'm not keen on paying a registration fee, but this conference, and I'm sure the European conference in Alicante, is going to be rich. And if there's a chance that you can get along to that,
Yeah.
it's a great networking opportunity. There are a lot of people that go to these conferences, and they're all very much in your sort of territory or domain.
Thank you for the suggestion.
Well, that's okay. I mean, I hope I'm self-employed, and I'm fortunate that I have the luxury to choose who I work with and what I do with my time. I work full time, and it's by choice, not because I have to. And I suppose my passion is helping people to fulfill their potential. So this is why I try to organise events like this, to raise awareness of what people are doing in the area of health and well-being, and perhaps give opportunities to connect them. Well, we've had actually a couple of comments. I have something. Yeah, somebody's. I'm going to show it on the screen. They've been able to listen to what I've been talking about. Unfortunately, nothing's shown on the screen. And I wonder if that's the case for all attendees. I hope not. You can see, presumably me, you can see yourselves on the screen, so you have no problem with that. And the other question was, please let me know the Alicante details. So I will try and answer that question and give you an opportunity to carry on talking, and just say a little bit about what your future plans are, anything you're looking to achieve as a result of this interview today, anybody you would like to connect with, then this is an opportunity for you to say something now. So whilst I'm looking for the website for the European Lifestyle Medicine Conference, perhaps you'd like to carry on talking and sell what you've got to offer.
Okay. So I can start.
Okay.
I can start with some of the plans. Yeah, thank you.
Okay.
So obviously, some of the plans have to do with clinical development of our solutions, finding more partners that are interested in testing our solutions. So definitely on the clinical development side of things. There is another layer that we are now starting to work with, which has to do with AI. So I mentioned that we have a database of almost 68,000 registered users. And the idea is to try to look a little bit of their data. So as Nicolas mentioned, the importance of data. So while you're playing, you're gathering a lot of gameplay data from which is actually possible to extract variables, different variables, behavioral variables, motor control variables. And so last year we have a person, in the end of last year, we had a person join the team and trying to, using AI, explore a little bit of the partners that we have. The data that we have in order to find digital biomarkers that can be used, for example, in the diagnosis, in the monitoring of different cognitive illnesses. But in terms of development of Enhanced VR, further development, let me pass the ball to Nico.
Yeah, thanks. So yeah, we keep developing Enhanced VR. This means that to the 15 games we have now, we keep adding. Now we are currently working on a new game, but not. This is one of many new games that we are going to implement in the near future. We are covering all the categories we have with several games, so the games don't. So people has the chances to play different games to exercising in the same categories, and this is part of the process of the development of Enhance. And for that, what we do is the method we use to develop the enhanced games is looking into the literature, to the well-established tests, neuropsychological tests that were validated in the clinical setting. And that's part of my job, to look at them, take a look at what's out there and select those that I think they have potential to become a new game. And then together with our game designer in the company, we discuss this. We select which ones are the more interesting, or the ones that could be more easily or more nicely adapted to be engaging, to be fun, but always keeping the mechanics of the original test. So those categories that we are tackling are really the core of the gameplay. And with that, that's only the starting point, but because with that we open the discussion to the rest of the team. We have developers, 3D artists, and everyone in the team is welcome to test and say what they think about what we are developing. And yeah, for the future, we are planning new games in the categories that we have, and eventually adding some new categories as well.
Can I now you just mentioned that, and it just triggered my memory that I'm actually doing a talk at a virtual event in India on Friday, and it is on the impact of AI on gamification and serious games. So I'm going to ask you about that in a second, but the question I want to ask is have you or do you use some of the AI tools available at the moment for making creative content? And in particular, I'm thinking of Blockade Labs Skybox AI, if you've heard of that, because that is an AI application that allows you to create really realistic 360-degree environments through text. So you just tell it what you want, and it will generate that 360 degrees environment. And the other one is it's a range of applications developed by a guy who's very entrepreneurial and persistent. They're called Paul Ponner, and he's developed quite a portfolio of AI-related apps, web-based, cloud-based applications that work on the web as well, called Human Pal, Human Talk, Artistly AI, Talking Pictures, and all of these are tools that primarily you can use to market yourself. And the latest one is called ClickSite, and basically what ClickSite does is it will generate a fully functional website with all the SEO data, and it will do it in the matter of minutes, simply by telling ClickSite's AI what you want, and it's very impressive. It's very impressive, and it does allow you also to modify the website yourself. But as a starting point, if you for wide range of primarily industry sectors, like small businesses, I think it's targeted at, so butchers, bakers, florists, and that kind of thing. It's a way of creating a brand new website in a very short space of time, and also publishing it. You can do that, certainly. You can do the whole thing within an afternoon. So that's quite impressive. So we're coming to the close now, and I want to thank you for your time and just give you an opportunity, starting with Bebiana, if there's anything else you want to say before we finish today.
No, just thank you for the opportunity to be here today, and tell your viewers that if they are interested to discuss either Inés, Cogniclear development efforts, we are definitely here and all ears, and looking forward for their contact.
Wonderful. Nicolas, anything you want to add? Yeah, I totally second what Bebiana said. We are looking forward to see what's coming next. We're looking forward to how clinical partners to gather data and keep pushing this forward, and hopefully have something that it's really useful for the people out there. Well, wonderful. Well, thank you very much again. For the person who asked me the Alicante details, I've put in the website there. It's bslm.org.uk events. You can see it in the chat box. So if you are interested,
I'm going, certainly. I wouldn't miss it. And possibly I will see you there, or possibly even see some of the people who joined us today, or watch this webinar recording afterwards. So thank you again. I'm going to close the session down now. Thank you.
Thank you very much.
Thank you, David.
Bye-bye. Bye-bye.
Bye-bye.